Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before giving the bedpan, check the care plan. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi, I'm Robin. I'm going to be your nurse assistant today.
Okay, hi Robin.
How are you doing?
Just fine, thank you.
Good. If you don't mind, I'd like to check your identity.
Sure.
Could you tell me your full name?
Jane Franklin.
And your date of birth?
October 22nd, 1959.
Okay, thank you, Mrs. Franklin. I understand you called for the bedpan?
I did.
Okay. I'm going to go ahead and get the things that we need, and then I'll be right back, okay?
Okay, thank you.
You're quite welcome.
Before giving the bedpan, practice hand hygiene and put on gloves. Then collect the items you will need and arrange them on the chair or bed. Also, lower the head of the bed and position the person supine. Or raise the head of the bed slightly for her comfort. Then lower the bed rail near you if it's up. Fold the top linens and the gown out of the way, but keep the person's lower body covered. If needed, warm the rim of the bedpan, then dry it thoroughly. Next, ask the person to flex her knees and raise her buttocks by pushing against the mattress with her feet. As she does, slide your hand under her lower back and help raise her buttocks. If you're using a waterproof pad, place it under her buttocks. Now slide the bedpan under the person. If the person can't assist in getting on the bedpan, first place the waterproof pad, if used, under his buttocks. Then, with him positioned on his side facing away from you, place the bedpan firmly against his buttocks. Push down on the bedpan and toward the person. While holding the bedpan securely, turn him onto his back. Make sure the bedpan is centered under him. Now, cover the person and raise the head of the bed so that she's in a sitting position to use a standard bedpan. If required, remove your gloves and wash your hands before raising the head of the bed. Make sure that the person is correctly positioned on the bedpan. The urethra and anus should be directly over the bedpan's opening. Raise the bed rail if it's lowered and place the toilet tissue and call light within the person's reach. Ask her to signal when she is done or needs help. If required, also ask the person to use hand wipes to clean her hands after wiping with toilet tissues. Remove and discard your gloves and practice hand hygiene. As you leave the room, close the door. Return to the room when the person signals, or every 5 minutes to check on the person. And always knock before entering. When you return, practice hand hygiene and put on gloves. Then raise the bed for good body mechanics and lower the bed rail and the head of the bed. Again, ask the person to raise her buttocks. As she does, remove and cover the bedpan. For a person who can't lift the buttocks, hold the bedpan while turning him onto his side away from you. Then remove the bedpan. If the person can't clean the genital area, clean it from front to back, using fresh toilet tissue for each wipe. If needed, perform perineal care, as shown in the video skill, giving female perineal care or giving male perineal care. When perineal care is complete, remove and discard the waterproof pad if it was used. Then remove and discard your gloves. Practice hand hygiene and put on clean gloves. Now raise the bed rail, lower the bed, and take the bedpan to the bathroom. There, note the color, amount, and character of the urine and feces. Then empty the bedpan's contents into the toilet and flush it. To continue, rinse the bedpan. Pour the rinse water into the toilet and flush again. Also, clean the bedpan with a disinfectant. Then remove and discard your soiled gloves and practice hand hygiene. After putting on clean gloves, return the bedpan and clean cover to the bedside stand or place it in the bedpan holder. Follow agency policy.
Franklin, I just wanted to double check with you, make sure that you're feeling okay. And did you complete your hand hygiene?
I did, thank you.
To complete the procedure, remove and discard your gloves and practice hand hygiene. Confirm with the person that she performed hand washing. After giving the bedpan, perform post-procedure care. For example, lower the bed to its lowest position and raise or lower the bed rails according to the care plan. For detailed information, see the section on follow-up care, reporting, and recording in this program.